What is an abortion procedure? In this video, we'll talk about the abortion procedure in the first 12 weeks of pregnancy, counted from the start of your last period. We'll describe how you can access an abortion procedure, how it works, and how it feels. In Canada, the abortion procedure is legal at any stage of pregnancy and is free if you have Canadian health insurance. The abortion procedure is sometimes called a surgical abortion, vacuum aspiration, dilation and curettage, or D&C. These all describe the process of removing pregnancy tissue from the uterus using vacuum aspiration. So, how do I get an abortion procedure? In Canada, it can be done by a gynecologist or a specially trained doctor. Depending on where you live, you may need to travel. Each hospital or clinic has its own rules about companions, so check ahead of time if you want to have someone come with you. You can make an appointment for yourself or through your primary care provider. You may have a consultation beforehand or a follow-up to make sure the abortion worked. The entire appointment is 1 to 4 hours. It includes time for an exam, to read and sign forms, and to stay in the recovery room for up to an hour after the procedure is done. So, how does it work? Before the abortion procedure, you take antibiotics and are offered medications for pain and to relax. A nurse will stay to support you throughout the procedure. Then, the doctor will open the vagina with a speculum and will use a needle to freeze the cervix. The doctor will gently open your cervix using a series of thin rods called dilators. Last, the doctor will place a small tube into your uterus and will use gentle suction to remove the pregnancy tissue. During the procedure, you will hear the machine, which sounds similar to a home vacuum or suction at the dentist. In total, the procedure itself takes around 5 to 15 minutes. Once complete, you will stay in the recovery room for about an hour before going home. After your appointment, someone must take you home by car or transit. Some clinics allow people to leave by taxi alone or can arrange for a volunteer to drive you. So, how does it feel? Most people feel some discomfort. During the procedure, you will feel moderate to strong cramping like period cramps. It usually improves within 20 minutes. You may have some period-like cramps for a few days after the procedure, and light bleeding or spotting for around 2 weeks. Nausea, diarrhea, and headache are also common. Talk to your doctor if you have questions about managing these side effects. The abortion procedure has no effect on fertility or your ability to get pregnant in the future. Less than 1% of people experience serious complications. But if you have any concerns about your abortion, it is best to speak to a healthcare provider. If you are less than 10 weeks pregnant or want to have your abortion at home, you can choose to have a medication abortion instead. Want to learn more? Check out the links in our description below and visit It's My Choice at sexandyou.ca.